Alright, ladies and gentlemen, we are on the home stretch of renal and vascular pharmacology. This is the fourth part of this series, and it is entitled Hypolipidemics. The objectives for this section are that you can identify two common hypolipidemics. You should be able to identify the primary clinical indications for hypolipidemics, and you should be able to explain the mechanism of action of HMG-CoA inhibitors, and we'll talk more about that later. Okay, again, a little bit of background here. What we're talking about as far as clinical indication for these medications is we're talking about atherosclerosis. And atherosclerosis is that progressive condition that leads to coronary artery disease and peripheral artery disease, whereby you get the plaques, fatty buildup of plaques built inside of the arteries. It's a disease that begins early in adulthood, and the thing is, we're even seeing it in childhood. There's been autopsies done on 4-year-olds that have atherosclerosis. You have to think as to what the Happy Meal has done for the state of our country. But off of that soapbox. So what happens, even in these kids, fat starts building up along the smooth lining of the arteries, and then this accumulated fat, which is a mixture of cholesterol and calcium and cell debris and other stuff that's in the blood, just kind of builds up and builds up and builds up till eventually either it clogs the artery or a small blood clot gets in the now narrow lumen and clogs an artery. Blood that doesn't go through causes death to the tissues that are behind the clot, or I should say in front of the clot. So you don't get nutrients to the tissues, and the tissues die. Particularly, we're thinking of the heart, because those are some of our narrowest arteries that can get clogged off very quickly in coronary artery disease. But we also see peripheral artery disease in the legs and the fingers and the feet, where the arteries get filled up with these plaques, and therefore we don't get blood flow to the limbs, or to the toes, or to the fingers. So we're going to follow this one through, talk about hypolipidemics by talking about Joe. So Joe is a 48-year-old overweight male who smokes. His nurse practitioner prescribes him Lipitor. And Joe asked the following questions. What is Lipitor? How does it work? Why should I take it? Are there any side effects? And does this mean I can eat anything I want? So we're going to follow through on Joe's questions here and see if we can get them answered for him as we finish off this section. So Joe's first question, what is Lipitor? Lipitor is an HMG-CoA reductase inhibitor. Big, long name for a group of medications also known as the statins. And if you look at the names, here's 3 examples. Lovastatin, rosuvastatin, and simvastatin, otherwise known as Mevacor, Crestor, and Zocor. And they should start to ring a bell from your drug summaries. Why are they called statins? Because that's what their generic name all ends in, and it's part of their chemical compound makeup. So Lipitor belongs to this group of medications called statins, and they are used to reduce serum lipoproteins. Now, we know that we all have these lipoproteins floating around our bodies, but some of us have too many of them. So his next question for us was, well, how does it work and why should I take it? So we can tell Joe that this drug works by decreasing the circulating cholesterol levels. And how it does that is it interferes with the liver's ability to make cholesterol. Your liver makes about 2/3 of your daily cholesterol requirement. So if we cut down on how much cholesterol your liver makes, we will cut down on the amount of it that's circulating in the body. So it works by decreasing the cholesterol in your blood because it decreases the amount that the liver makes. So now why should Joe take it? Because he has high cholesterol, and that high cholesterol is putting him at risk for coronary artery disease, peripheral artery disease, possibly a heart attack, or other complications due to lack of blood flow through those arteries. So the mechanism of action, again, of the statins is it's an enzyme that prevents the liver from making as much cholesterol as it normally would on a daily basis. So then if the next question, he wants to know if there's any side effects. And this is common of many patients because, well, when I start taking this, what's going to happen to me? And if they've seen any of the TV commercials and that, they know there's a whole list of side effects that goes along with them. So what we can do is we can tell Joe, yeah, there are some effects of these medications. Most commonly, you might see a little bit of muscle pain and leg ache and a little bit of muscle weakness. That's probably some of the more common ones that we see. The less common adverse effects would be that of a headache, dizziness, alteration in taste, insomnia, having trouble sleeping, abdominal cramping, this goes along with some of those muscle aches, and photosensitivity, difficulty when they go out into the sun. So they would be some side effects he might experience. But again, you sit back and say to him, hey, if you're having any of these, let me know. They could be dosage dependent, and we might be able to eradicate or limit them by just adjusting your dosage or adjusting the particular medication that you're taking. And the last famous question that comes along with these is, does this mean I can eat anything I want? Should we tell Joe a big fat no on this one? These medications are meant to be adjunct therapy in addition to dietary treatment. And so dietary restrictions should go along with these to help decrease the total serum LDL and cholesterol. We know that with these medications, and I put a couple stats up here for you, they can reduce the LDLs by up to 30%, and some even higher. I've even seen some stats of up to 45%, and they can easily raise HDL levels up by 20%. So as a result, they do a very good job of what they're supposed to do. But ultimately, the best job is done by you adjusting your dietary habits. And that's probably one of the hardest things to convince someone with this condition, is that yes, you're on a medication to help with this, but you do still need to watch what you're eating, decrease your fatty foods, decrease your cholesterols, increase your fiber, increase your fruits and veggies. And the best thing probably to do with someone who's asking this question is, if you can, refer them over to a dietitian that they can talk to, who can get them on a plan that they can live with for their dietary habits. That then ends our series of information on renal and vascular pharmacology. So on this last slide then, I've got a list of your drug summaries for our next section of information. and that'll be dealing with the peripheral nervous system. So some of the drugs that we're going to be talking about with the peripheral nervous system are Levophed, Lidoderm, adrenaline, scalaxin, and scopolamine. So you want to take those 5, research those, and put them into the drug summary form so that we have them to talk about next week when we talk about the peripheral nervous system. In the meantime, go on back through and review your notes. And when you feel comfortable with it, you'll want to answer the discussion questions and take this week's quiz on the renal and vascular pharmacology. Good luck!